Hello everyone. I'm here to talk about AI in healthcare and patient safety. Artificial intelligence has been around from 1956. It was founded in Dartmouth campus workshop. It became popular in 2010 with Siri and Alexa, and with ChatGPT and AI image generators gaining popularity in 2023. AI in healthcare has been around for a while, but most post-pandemic people started most frequently they've been used. Going to the slide, we are talking about improved diagnostics. So it has been in the history. So it has been in history for delivering the things like cancer, the liver disease, which are pretty much diagnosed later or missed by an human eye. Coming to personalized medicine, AI can find out what the patients are needing, the medicines for preventative care based on their genetic profile, age, hereditary diseases, and lifestyle on a regular basis. Moving to resource management, AI can help in the analyzing the seasonal trend, changes in the hospitals, like staffing based on the patient admission rates, sickness. It prevents understanding or overstaffing. By analyzing real-time data, AI can help in stocking things in the hospital, like the supply chain management, predicting any outbreaks seasonally to stock up supplies. Moving on, there is always pros and cons of anything. So here, moving on to the healthcare, privacy is one of the big concerns because lots of personal data is out, which are very sensitive these days. A data breach could be a possibility with the privacy and the lack of transparency. The privacy notes which we signed, they are very vague and broad, and it could be risky to the patients when they don't know what they're getting themselves into because they don't read everything. And when they are trying to sign for the surgery or treatments or consent forms, it is very vague. So that lacks transparency. Moving on to the high implementation costs and ethical considerations. Of course, high costs and artificial intelligence initial investments are huge on the maintenance and implementation is there. And ethically, it makes it very hard for the data privacy and security and loss of human connection, meaning everything's machine learning, and there's no compassion involved because as a human caregiver, we give real value to the patients face to face, which is lacking in case of healthcare and AI in the healthcare. Next, moving on to the patient safety, there's something called predictive analysis and early detection. Predictive analysis is one of the things where the patients who need care due to dependency in medicines and their risk of complications due to the chronic illness is high. Also, predicting risks for patients who are high fall risk is another thing, which is where the AI is proactive in informing the staff about whether the patient had a fall risk in the past admissions and how to take care of them in an efficient way this time. Then, next comes the clinical decision support. These systems can prevent hospital acquired infections. They are called nosocomial infections. What are hospital acquired infection? If a patient gets admitted to the hospital, he doesn't have any respiratory disorder, say any sores, bed sores. But due to being in the hospital, he could acquire certain things like flu or cold from the patient staff or any negligence from the staff not wiping down the tables, somebody sneezing. So they pick up, they're immunocompromised, they are going to pick up all the sickness from the hospitals. They didn't have it when they were admitted. And next comes the adverse drug reactions by monitoring the patient safety. That's another way to do the clinical decision support. Talking about automation, My husband and my daughter both are working in the automation industry. I hear a lot about how to automate things in and around the house, which is good in one way, but bad in other ways. So robotic coming to the automation, if we talk about robotic or robotic medications, there are robots available and being designed for dispensing right meds to the right patients. Barcode verification is another thing which can be automated to ensure accuracy, checking the barcodes of the patients and with the correct MRN, which is the medical record number with which we can give the medications or any injections. So we make sure it is being passed on to the right thing. So that could be automated with the robotic medications. Next, talking about the disadvantages, when we move on to the disadvantages, there are a lot of algorithmic bias. So the bias depends on trust in the patients and the doctor of the nurse, doctor and the nursing staff of uh, and the relationship with the patients. Too much dependence on AI, they are an algorithmic bias. Legal and ethical issues. When the data breaches occurs due to the AI related bias data collection, there is always a question of accountability and reliability. Implementation and validation is the next point, which we talk about inadequate training and support in the organization. People are resistant to the changes in the organization. So a lot of staff are very hesitant to adapt to the new change. So for validation, we cannot be going one size fits all, meaning it depends on the patient's situation. It could be the complexity of the patient's nature. Some could be geriatric, some could be pediatric, and there are different care levels associated with it. Then moving on to the human oversight, burnouts in work, the overworked hospital staff is very common, with these days being the staffing being a big concern, and we have a more patient to nurse or nursing assistant ratio, which is very difficult, and they have a burnout rate is very high. So even the doctors, nurses to patients ratio, they can lead to delay in the care and the misdiagnosis. Adapting with AI in healthcare. Next one we talk about is telemedicine. Telemedicine is has been in and around after the COVID-19 because that time when the patients were not, people were not able to go to the hospitals to take care for the minimal things, telemedicine started booming. It surged during the post-COVID because we started looking at making a video call to the doctor and taking the advice how the medication works and what to how to treat a cold or a cough or minimalistic things. If it's very critical, of course we need to go to the hospital. So telemedicine boomed post COVID. So that is how we adapt in the AI in the in healthcare. Next, administrative automation. Automated systems for like bill processing, we pay the bills, then claims processing, scheduling at appointments. These days we call for the automated systems and they schedule us for appointments with the AI, which is very good and it increases the efficiency and reduces the cost potentially. Risk prediction and intervention is the next one, which AI can predict the patient diagnosis based on their health needs. Like more complicated cases need to be attended than regular patients. And intervening at their earlier stages can reduce the risk. Risk with AI in daily life. Which is a data breach is the top of my head. Like I felt like the data breach is something which is a big concern because with AI, there's lots of data available online, which could be misused and that could be a stolen data from online without the consent from the patients. It depends on the patient's past data collection during the patient's admission process. Talking about misdiagnosis, voice or speech recognition software, there are a lot of glitches like misinterpreting the diagnosis online and showing wrong signs and symptoms. Patients do not can be duped by their own diagnosis. People do not Google your symptoms and your sickness. You are going to be misdiagnosed because they can tell you that you have cancer, you have lung issues just because your breathing is not fair, which is not a good thing. And next comes the regulatory uncertainty. The regulations in the AI is very strict, and certain things can be misled because of lots of information online these days. So this is not a good thing for the regulatory conditions. Concluding, concluding my topic here, we talk about the personal medicine. Personal medicine is one thing which always I feel is it can be pulled out from the AI because of lots of diagnosis could be available based on the past history, electronic health records, online, in the system, in the hospital, based on the past medications. You could say, okay, they had a heart disease, they are prone to stroke, they could be having they should be provided a blood thinner, etc., etc. And effective resource management. We have more ample resources in this AI world, but it could be managed better with proper use and care. Implementation validation is another thing which we spoke about, where the implementing the AI to this world is very critical. And telemedicine, of course, we all are used to the video calls with the doctors and the hospital care management these days in order to take care of us. And administrative automation also concludes this by saying that we are good with automating with the robotics, passing the medications, robotics doing automating by the bill processing and claims processing, etc. On the whole, I feel like AI has both advantages and disadvantages. What is the future of AI in 2040? I did not include in the slide, but I did research this because I felt like, what is it down the road by 2040? How could it look? There is a lot of things which could be AI based as part of our daily life, which talks about personal medicine, telehealth, health in the technology side, as we should be more on machine learning is part of the life. Economy wise, it will grow more automated, like assembly line workers, like Ford and everybody. They could be automated. Telemarketers will be automated by then. AI in space will be interesting, and I have a video to share